a former top official from the Trump administration, is challenging Senate Democrats' claims about Medicaid, arguing that the Republican plan to reform the healthcare program would actually benefit rural hospitals rather than harm them. Dr. Mehmet Oz, former administrator of the Centers for Medicare and Medicaid Services, stated that special interests are pushing misleading talking points to try and stop the most ambitious healthcare reforms ever. This statement comes as Senate Majority Leader John Thune from South Dakota and Senate Republicans work to finalize President Donald Trump's healthcare bill before a self-imposed July 4 deadline. The bill, partially crafted by the Senate Finance Committee, aims to fulfill the GOP's promise to eliminate waste, fraud, and abuse within the widely used healthcare program by implementing work requirements and removing illegal immigrants from benefit rolls, among other measures. Adjustments to the Medicaid provider tax rate have caused concern on both sides of the political aisle. Senate Minority Leader Charles Schumer from New York, along with Senators Ron Wyden and Jeff Merkley from Oregon, sent a letter to Trump and top congressional Republicans warning that changes to the Medicaid provider tax rate could negatively impact over 300 rural hospitals. Some Senate Republicans were also upset with the changes after the bill was released. Dr. Oz argued that only 5% of inpatient Medicaid spending occurs in rural communities, and that the bill primarily targets abuses by large hospitals with influential lobbyists. He emphasized a commitment to improving access to care in rural communities through investments in advanced technology, infrastructure, and workforce support, rather than maintaining a system that mainly benefits wealthier urban areas. Schumer's letter cited data from a study conducted by the Cecil G. Shep Center for Health Services Research at the University of North Carolina. He warned that if the bill passes as is, millions could lose their healthcare coverage and rural hospitals might not be compensated for services they are legally required to provide. Fox News Digital reached out to Schumer, Wyden, and Merkley for comments. Meanwhile, a report from the Trump-aligned Paragon Health Institute echoed Dr. Oz's sentiments, suggesting that special interest groups and healthcare lobbyists were spreading claims that Republican changes to Medicaid would lead to rural hospital closures. The report criticized a study by the Center for American Progress that claimed over 200 rural hospitals were at risk of closure. This study was based on potential changes to the federal medical assistance percentage, the portion of Medicaid costs covered by the federal government. Although these changes were considered by congressional Republicans, they were not included in the final bill. Despite this, alterations to the Medicaid provider tax rate have angered some Republicans, who caution against revisions that could close rural hospitals and strip working Americans of their benefits. The Senate Finance Committee went beyond the House's freeze of the provider tax rate for Non-Affordable Care Act expansion states by including a provision to gradually lower the rate in expansion states until it reaches 3.5%. Senator Susan Collins from Maine is working on a potential amendment to create a provider relief fund to address concerns about changes to the provider tax rate.